フォン・タイ先生による下水疫学調査による薬物モニタリングになります。タイ先生の、ご紹介をカルメン先生からお願いしたいと思います。
So we are very fortunate to have Associate Professor Phong Thai. So Phong is a career researcher with a keen interest in environmental health and monitoring. Phong joined the Queensland Alliance for Environmental Health Sciences as a senior research fellow after his fellowship at the Queensland University of Technology. So the key focus at his work involved the expansion of wastewater-based epidemiological approach to determine the community consumption and exposure to a range of illicit and licit drugs. And that also includes pharmaceuticals and personal care products. Besides, he's also working on projects of monitoring emerging environmental pollutants in different matrices. Phong has been awarded several competitive fellowships for his research, and he's involved in a number of projects totaling more than $2 million in funding. So I'll pass it over to you, Phong. Thank you.
Thanks, Carmen. And konnichiwa. So in my introductions, I left out that the fact that I graduated not too far away from the institute. So I graduated my master and my PhD from Nokodai, and actually I have stayed in the dormitories of Nokodai campus, of Nokodai in Kodaira for a few years. So it's very happy to join the symposium today as a presenter and share my experience with wastewater-based epidemiologies. So first of all, we talk about the concept of wastewater-based epidemiologies. It's quite simple. When you consume drugs or you are exposed to pathogens, it's go through your body and you excrete it to the toilet. After you flush the toilet, the wastewater go to the wastewater treatment plant. We take the sample at the wastewater treatment plant inlet, take it back to the laboratories and analyze it for the biomarker of drugs, biomarker of pathogens. And we back estimate it into the population consumptions or population's exposures or infections. Later on, I would give example of population's consumption of some substance, as well as the population's exposures to COVID-19. So this is the joke, the basic joke of wastewater-based epidemiologies. So if you eat a lot of corn, people in the wastewater treatment plant can see that you eat corn for your breakfast. In reality, it's quite complex because in the community, you have a lot of contributor to the wastewater. You have hospital, you have factories, school, and other factor. In the population, you have old people, young people, some drug user, and some non-user. All of them contributed to the wastewater treatment plant, to the wastewater sample that we collect at the wastewater treatment plant. For some of them, we have to store in the freezer for a long time before we can take them to the laboratories, treat them, and analyze for concentrations of biomarker in the wastewater sample. After we have the concentrations of the biomarker in the wastewater sample, we can calculate the total mass of the biomarker in the wastewater flow by multiplying the concentrations with the wastewater flow, and then back estimate one step further by multiplying the mass load with the excretion factor. So it's going into detail, but you need a factor to convert what you excrete in your feces or urine to the amount of drugs or pathogen that you are exposed to. First of all, I would like to say that I have been working with Wayne Hall, our first presenter of the day, on wastewater-based epidemiologies for a long time. And the first thing we are concerned when we work on wastewater-based epidemiology is the ethical issue. Is there any ethical issue with the wastewater surveillance? For most of the time, we collect wastewater from catchment, which large number of people, usually more than 100,000 people. So you don't really need to get consent from each participant of the study, and it's actually impossible to get consent. And because wastewater that we collect is well mixed from 100 or 10 or 100,000 people, you cannot go into individual, and then it means that the privacy of each participant or each person in the catchment is not violated, and there's no direct risk of individual from the study result unless you go upstreams and study a very, very small catchment that we can discuss in other sessions. So Wayne have led a paper talking about the ethical issue in wastewater analysis, and we conclude that if the catchment have about more than 10,000 people, then there would be no ethical issue in using wastewater analysis for monitoring of substance use. Because Japan is still very early in terms of using wastewater to monitor substance use, I think it would be useful to share our experience with wastewater-based epidemiologies. We also developed the approach or the method from a very small scale. It starts from actually a PhD project where Professor Uni Lai in Sweden, she started by collecting wastewater from one small catchment and then another catchment. And then, as you can see in the slide, we have a few catchments where we can compare the drug use profile of cannabis, methamphetamines, cocaine, and MDMA in Queensland. And clearly, wastewater-based epidemiology work because we can see the difference between those catchments. We also take sample from Hong Kong, where we couldn't detect cannabis. By then, we didn't know that cannabis couldn't be detected in sample acidify, but now we know maybe we can revisit and then analyze cannabis from other sample in Asia. So the projects go on, and we store sample for long-term monitoring of substance in Queensland. For my part, I was interested in NPS, novel psychoactive substance. So around 2010, 2012, there's a high interest in cathinones, for example, methylone and mephedrone. So we have collected more than 400 sample over 3 years to analyze for methylones and mephedrones in a touristic catchment of Queensland. As you can see, we detect a lot of methylone in the sample, but we couldn't detect mephedrone. The reason could be that mephedrone is prone to degradations in the sewer, even those in seizures, the level of methadone seized by the police is higher than the level of methadone. With methadones, we can see the weekly use patterns. So it's higher during the weekend and lower during the weekday. So the catinone substance have the same patterns of use as MDMA ecstasy. The reason why I use this data to showcase to the audience is because when I write this paper, I remember the only paper that described the detections of methadones in drug user is a paper from Japan. So actually, in toxicologies or substance use study, Japanese researchers have described the use of different substances in Japan, but I couldn't convince my colleagues who work on wastewater to allow me to analyze illicit drugs and then publish the data, because the wastewater treatment plant operator doesn't want to reveal that there's drug in their wastewater. Up to 2015, we have an impactful finding of wastewater-based epidemiologies that basically change the directions of wastewater-based epidemiology in Australia. So by 2015, we detect a huge increase of methamphetamine use in Australia, as you can see in the figure, about almost 5-time increase in an urban area in terms of meth use, and about 3 times in a regional city. It triggered the response of the government, the Australian government, because at the same time, we didn't see any increase in MDMA or cocaine use in the same catchment. It means that methamphetamines had become a really high risk and a big issue for the government and the public health system in Australia. Following that, the Australian government have support us to establish a national wastewater drug monitoring program. This is not the latest number, because the latest number we have more catchment and we have a higher coverage. But even in 2017, when we first established the programs, we have recruited wastewater treatment from all the capital of 7 states and territory in Australia. At the peak, we cover about 14 million people. It means 60% of the Australian populations. So every 2 months, we collect up to 7 wastewater sample from each treatment plant in the capital, in the urban area, and every 4 months, we collect a sample from the rural area, because logistically, it is more challenging and difficult to collect sample in the rural and remote area of Australia. All the sample are de-identified. We give each of the treatment plant a code number, and we only report the code number in all the documents. So we cover the population distribution of the program. It's 67 in the capital and 33% in the regional. It really helped, because usually when you conduct a survey, for example, in Australia, we have the National Drug Strategies whole survey. It's a real challenge to go to the rural and remote area to do the survey. But by wastewater monitoring, you can get regular information from the remote and rural area. And this same principle applies to every country. So what can we use wastewater based epidemiologies for? The most important or the best advantage of wastewater based epidemiologies is to show the trend of substance use or pathogens or disease over time. Like I showed you the data before about methamphetamine increase in Australia. With the temporal trend, you can use to assess whether your interventions, the new policies is working. In Australia at the moment, we are using wastewater-based epidemiologies to assess whether the ban on vaping it's effective or the increase in tobacco tax is working or not. We can see whether big seizures of illicit drug have any impact on the illicit drug market. The other benefit of wastewater-based epidemiology is to compare drug use in different catchment or different, like in Japan, it could be different prefectures or rural versus urban area. But there's more challenging to compare spatial difference because there's issue with wastewater sampling and the demographic of each treatment plant. From our national wastewater drug monitoring programs, we monitor the key illicit drugs, as you can see here, methamphetamine, cocaine, MDMA, cannabis. Somehow I left cannabis out a bit. We also have tobacco and alcohol. Some opioid, oxycodone, fentanyl, and we can add NPS into that mix, like ketamines. We also monitor methylones. And then regularly, the data is published on the website of the Australian Criminal Intelligence Commissions. This is a screenshot of the website, and then you can go there to see the latest report from us. It's all open with full data and data from each treatment plan. It's code with their internal code. One interesting point about wastewater that you can see with a large amount of data, big data, you can compare the demographic and the use consumptions of different substances. In this figure, you can see that when you have higher income, you tend to be eating healthier. So they have we found that there's higher level of vitamin use, caffeine use, and fiber. If you are older and poorer, you tend to use more painkiller, antidepressants, and yeah. So this is an example. We are using wastewater-based epidemiologies to evaluate the policy in Australia. We know that in Australia, alcohol use is a big issue, and particularly in the Northern Territory. You can see in the graph, the level of alcohol use in the Northern Territories, it's almost double the national average. So the government have tried to implement different alcohol control in the regions to tame down the level of use. One of them is to apply the minimum unit price. So each unit of alcohol in the Northern Territory should cost higher than the minimum cost. And in this figure, you can see that wastewater can tell you that right at the point of the implementation of the policy, the minimum unit price, you can see a significant drop in alcohol consumptions in the territories. But as time passed, people try to find a way to adapt to the new policy, and the consumption level gradually go back to the initial level before the implementation of the policy. So this is the benefit of using wastewater-based gemology, because you have a high level of granular data to evaluate the public health policies. Another successful story about using wastewater-based epidemiologies to evaluate change in policy is that after the opioid crisis in North America, Australian government tried to strengthen the regulation around oxycodone use, and with the tighten of the rule, you can see a decline nationally and in all states of oxycodone use in the populations. So we can see this is effective. The change is effective and sustainable for at least a few years after the implementation of the change. My favorite story is about the use of wastewater-based epidemiologies to monitor tobacco use in Australia. This is my old photo taken 2 years ago. By now, I think I remember 2 months ago, the price of a package of tobacco in Australia, in Japan, already increased to 500 or 600. But it is almost still very, very cheap compared to the price of a packet of cigarette in Australia. If I were in the on-site, I would ask you to guess what is the price of a package of cigarette in Australia. And my guess is none of you could guess correctly the price of a package of cigarettes. It's about, I think at the moment, it's about 4,000 yen per package in average. And that's why, sorry. So because the price of the tobacco in Australia is very, very high, we can see a decline in nicotine consumption. At the moment, in this figure, we use nicotine as a biomarker, nicotine and its metabolite as a biomarker. So we see a decline from 2017 to 2019. And then a little bit pick up during the early period of COVID, and an increase in sale of nicotines in nicotine replacement therapy. So more and more people want to quit smoking because of the higher price of tobacco. But at the moment, we are working on a project to see how much nicotine use in Australia are coming from e-cigarette, like Carmen has presented, and how much of them coming from legal tobacco and how much of them coming from illegal tobacco. We have collected some sample from Japan and analyzed for alcohol. I haven't finished the data analysis, but from our one catchment, from our sample from one catchment in Tokyo, we can see that the level of alcohol consumption in Japan, it's pretty high, even during the COVID lockdown period. We can also detect some illicit drugs in wastewater from Japan. At the moment, we can only see methamphetamine at a very, very low level. Very, I have to say, compared to all the high bar of different Europeans and Western country, the level of methamphetamine detected in Japanese sample, it's very low. I understand that now at the moment there's a lot of interest in the use of cannabis in Japan. And I can share with you that we also detect signal of cannabis in wastewater in Japan, but also at very low level. So what I can want to say is that wastewater can be used in Japan to objectively measure the level of drug use or substance use in the populations. And the example of how wastewater can be used successfully in Japan for public health surveillance is through COVID-19, because you know that during COVID, wastewater-based epidemiologies have been used as an early warning system for COVID infections in the community. I was a coordinator of the wastewater surveillance for my state, Queensland, and we can effectively use wastewater to detect sometimes only one case in 10,000 people, helping the state to avoid large-scale lockdown, which is very costly. So it is widely recognized that wastewater can be a very useful tool for public health surveillance. And in Japan, researchers in different universities have joined together to establish the COVID-19 task force from the Japan Society on Water Environment. And there's been a lot of paper published about the monitoring of COVID-19 in wastewater in Japan. By now, it is well established that wastewater-based surveillance can help public health as an early warning system for not only disease but also substance use. And I'm sure that we can apply it in Japan. If you want to convince somebody about the uses, the good uses of wastewater-based epidemiologies, you can go on the UU Wastewater Observatory for Public Health website, and they even have the Internet cookbook for wastewater practitioner. And that's all I wanted to present today. This is the last presentation, so I want to make it short. Thank you very much for your attention.